heart health a concern for some Asian American communities? Hi, I'm Faraz Javed for 7 Action News. Here's how some lawmakers across the country are pushing for legislative changes to create more awareness. Dr. Alison Thomas and Dr. Nicholas Condolian work at Corewell Health in Royal Oak. Both also attended Oakland University William Beaumont School of Medicine, class of 2020.
It's a school that's kind of built in a community, and everyone is very close with each other.
But some memories bring tears to their eyes.
It just doesn't feel real still.
Their classmate and dear friend, Dr. Irfan Farid-Moyer, died of cardiac arrest last year in December. He was a 30-year-old general surgery resident in New York.
Always had our back, always was comfortable with, everyone around him, and
Joy.
he definitely radiated joy.
Someone who never stopped smiling.
Dr. Farid-Moyer came to the U.S. from Iran as an international student to complete his undergrad before attending med school.
Irfan was working probably over 100 hours a week, busting his butt to take care of all these patients. We're young and we're healthy, but there's still things like this that could happen.
Family physician Dr. Asha Shahjahan started looking into why young West and South Asians are experiencing a higher mortality rate from a cardiac event after 2 of her close friends, a 30 and a 40-year-old, died from a heart attack.
So I found that South Asians tend to have heart disease about 10 years earlier than other ethnic populations, and they have a 40% mortality rate.
Dr. Shahjahan says West Asians also have an increased risk at younger ages, with most events occurring before the age of 50.
What's causing this right
So
now?
there needs to be more studies, but it is multifactorial in the sense that South Asians are found to have more narrow vessels. The difference with the Asian population is that when you say Asia, it lumps together several different countries, and the results are skewed.
That's why Senator Cory Booker and Congresswoman Pramila Jayapal are working on legislative changes to raise awareness and study the impact on Asian American minorities.
The prevalence of type 2 diabetes, a leading cause of heart disease, is the highest in America amongst South Asians.
The bill specifically would provide grant funding to support some research to understand why certain communities are disproportionately affected by heart disease. And we think it would potentially lead to discovery of new life-saving therapeutics for all patients.
While the South Asian Heart Health Awareness and Research Act heads to President Biden's desk for approval, Dr. Thomas and Dr. Condolian are working with Oakland University to establish a scholarship in honor of Dr. Farid-Moyer.
We hope, to award a scholarship to a student every year. Once we reach a certain amount, the school will continue to fund it.
Now, to learn more about the scholarship and the bill, just head to WXYZ.com. Also, Dr. Shahjahan says early screening and leading a healthy and active lifestyle are key to fighting heart disease. For 7 Action News, I'm Faraz Javed.